Dr. D.K. Gupta, Chairman of Felix Hospital, now joins us on this broadcast. Dr. Gupta, thank you so much for speaking with us here on CNN News 18. You know, this is the same story, it's the same discussion, unfortunately, we have every single year. We do hope that things change, but year on year, it's the same story. Sometimes it's just for the worse. Have you noticed any increase in perhaps your outpatient intake as far as those showing up with symptoms because of this pollution is concerned in the recent past?
You are absolutely correct that in the past 1 week there are lots of patients coming in emergency in OPD, that is outdoor department, for consultation because of respiratory symptoms. They are coming with cough, irritation, choking, chest pain, breathing difficulties, and these are the common symptoms. And most of the patients mostly they are requiring OPD treatment, but few of them require the nebulization oxygen, and few have been admitted to the ICU also, in the wards also.
Dr. Gupta, every year we see the same thing happen. The governments come out and say that we've taken A measures, we've taken B measures, but unfortunately nothing changes because the life of the people, those who have respiratory diseases already, those who are asthmatic patients, it just becomes worse for them. What are the precautions that can be taken?
We all know that it is month of October or November in Delhi NCR. Delhi NCR whole becomes a chamber of gas. Actually, these gases are toxins, and they are highly toxic to everybody, especially children, pregnant ladies, premature babies, infants or toddlers. I think we have to take a lot of precautions. If we talk about the pregnant ladies, definitely there can be premature labor pain, premature delivery that can be harmful to the mother also, and it can cause serious side effects and complication in the newborn and newborn baby, and neonate, that is called. Therefore, I think pregnant ladies, senior citizens like 65, 70 years plus, and they are having comorbid conditions like diabetes, hypertension, asthma, COPD, and on dialysis, or having cancer or an immunosuppressant drug, they can suffer a lot. They can have heart attack, they can have cardiac failure, they can have respiratory failure, they can have bronchial asthma, exaggeration of asthma, COPD, bronchitis, respiratory problems. They can have there are lots of problems can happen to these like vulnerable group, and they should definitely confine to them to the indoor houses. They should not come out. Only in case of emergency they should come out, and in emergency also, whenever they are coming out, they should wear a N95 mask, and they should always avoid the morning or evening walk during this, because air quality index is more than 500, 600, even 700, more than 400 in everywhere of any part of the region right now, and that is highly toxic, hazardous. That is hazardous. So these hazardous toxin, if they inhale, they can cause serious side effect and complication to these population. If we talk about the children, they should not be exposed. Already the Delhi government has closed the schools. I think Noida has not closed right till now. Yes. I think schools should be closed because early age group, if we talk about neonate to toddlers, even up to 5 years, the brain development is quite good, and that is the most important time for the brain development. This pollution can delay, can had defect in the brain development, can cause growth retardation in the children, and can cause bronchitis, can cause bronchiolitis, asthma attack, and respiratory problems. They may need maybe nebulization or oxygen, maybe admission or bronchodilators, steroids. So I think there is a lot of charge right now going around this Delhi and NCR. Everybody, even the Yuva, I think the young patient population, they are having severe symptoms. Myself, I am coming from Chennai 2 days back. That was very good weather and there was no problem at all. Whenever I landed in Delhi, after a few hours, I started scratching the throat, itching in my eyes, running nose, nasal congestion, rashes in the skin, like watering from the eyes. Sometimes if you are persistently exposed to this higher toxic environment, you can have severe headache, irritation, depression, poor concentration, poor focus. So these are the symptoms anybody can have. Even for long-term exposure, patients can have obesity, asthma, COPD, hypertension, diabetes. These non-communicable disease can, even cancer is proven because of this long-term exposure of this air pollution. Even the immunity, it causes the compromised immunity also. If you are
absolutely, and we see the short-term symptoms, we see the short-term ailments that ail us. We think they'll be gone, but in the long term, there are issues that may remain, and that really is the biggest threat, which is why the most vulnerable sections have to be very, very careful. Dr. Gupta, thank you so much for joining us here on this broadcast and sharing your perspective, and also sharing your expertise on how precautions can be taken in this time, because unfortunately for the people of Delhi and the National Capital Region, this is the kind of air we will have to keep breathing at least for another 2 to 3 weeks. Diwali is just around the corner. Diwali is next weekend. It's only going to get worse, is what experts believe.